Hi everyone, welcome back to my channel. In today's video, I am going to be discussing a topic that I've gotten tons and tons of questions about, and that is the difference between medical school and dental school. I have so many people who email me and say that they are trying to decide between the two and they're not sure which one is the better fit for them. And so I wanted to take some time to talk about my story and my experiences so that maybe you can find them helpful. I actually went to both dental school and medical school, so I don't think there's a lot of us who have done that, and it's kind of a unique opportunity to be able to compare both of them firsthand and give you real experiences, because a lot of times when you're pre-med and you're an undergrad, it's one of the biggest decisions that you make. Do I go to dental school? Do I go to medical school? Which one's going to be a better fit for me? Which one's going to be a better lifestyle? And those are all very, very important questions and could take a big toll on you when you're trying to make that decision, because essentially it affects you for the rest of your life. And so it is a big decision, and a lot of times, you'll talk to physicians, you'll talk to dentists, and you'll try to figure out which one is best for you. But the problem is, the physician only went to medical school and the dentist only went to dental school, and so they can only give you their perspective on, their experience. And I thought that it's finally time that I could, give you firsthand my experience in both, and hopefully you will be able to make a better choice for yourself using this information. This is by no means, a comprehensive list of all of the different experiences that I had, but it is a little bit of a highlight in how I feel in a nutshell about both kinds of programs, and what in retrospect, what I may have done and things like that. So before we begin, let me tell you a little bit about myself. I am an oral and maxillofacial surgery resident. This is a dental residency that you can do after you complete dental school. So I graduated dental school, and then I started my residency. Oral and maxillofacial surgery residency, or OMFS for short, is a program that you can accomplish in 4 years or 6 years. The difference between the two is the 6-year program, you actually go back and do about 2 years of med school, give or take, depending on the program. And at the end, you finish up medical school and then do gen surg, anesthesia, and then OMFS, and you're an MD DDS. And I ended up choosing the 6-year program because I wanted the opportunity to do fellowship in case afterwards I want to subspecialize in craniofacial or oncology, plastics. And in order to do that, it's a lot easier to do a fellowship after medical school than the 4-year program. You can certainly do some things with the 4-year program, but if you wanted to go on and do fellowships, and it might be just a better opportunity through the 6-year program. And so that's why I came to the decision to do the 6-year program. I also really wanted to just have the opportunity to go to medical school, because it was something that I wanted to do before and just decided not to, and so it kind of came full circle. Okay, so I would say the biggest difference between my experience in dentistry versus being in medical school is definitely the hands-on aspect. Dental school is very, very hands-on. Dentistry in general is very, very hands-on. Everything that you do, any specialty that you do, you have to be hands-on. You have to be good with your hands, and you really just get in there. I mean, this is your space. This is where you're working, and you are, creative, and you can do a lot, and you certainly can specialize in different things. Like if you like working with children, you can go into pediatrics. I will do a whole separate video about specialties and why because I did at one point decide between pediatrics, ortho, and oral surgery, or general practice. And so I have some experience in that, and I'll share that with you guys as well. But, for the most part, you really can do a lot in dentistry, but you're always very, very hands-on. I think that's the biggest difference. In medical school, especially medical school itself, it's a lot of didactics. It's a lot of learning in the hospital by shadowing your fellow classmates while you're shadowing attendings and other residents. And so it's not as hands-on. Here's the caveat though. You can still go to medical school and be hands-on if you choose specific specialties. So, for example, if you want to go into surgery, of course you're going to be hands-on, but that's surgery. So you can't really be in, family practice and expect to be super, super hands-on, because you might not be able to. Of course, there is some aspect of being hands-on, you're doing physical exams, you're doing things like that, but if you want to do more with your hands, you can of course find a specialty that does that in medicine. So surgery, or you can do dermatology, OBGYN. But for the most part, if you want to go into internal medicine, if you want to do family practice, if you want to even, go into and become a cardiologist or any other specialty within the umbrella of like internal medicine, which is the biggest, umbrella in medicine, you are mostly diagnosing, triaging, and referring to other specialists. And so your role is extremely important because you are getting patients to where they need to go and you are coordinating patient care. But unless you're an interventional cardiologist or you're a cardiac surgeon, you're not really doing too much with a person hands-on if your specialty is cardiology. And so I guess that was really the biggest difference for me between dentistry and medicine. In medicine, you have to go into very specific specialties and subspecialties if you want to be hands-on. And in dentistry, everything requires you to be hands-on. So that was the biggest difference. So you really have to evaluate yourself. Do you want to have a relationship with your patients and triage and be able to sit down and really be an investigator? Because in medicine, a lot of times patients will come in, they'll have all these problems and you're an investigator. You really have to figure out what's wrong with them and you're putting everything that you know together. It's really exciting and it's really cool. But it is very different than, sitting down and doing a crown on a patient where you have to physically, be there, prepping the tooth and doing that. So it is totally different. They're both extremely exciting and really incredible fields on their own, but that is kind of the difference that I've experienced between the two. The other difference is also the time factor. Dental school, after 4 years of dentistry, most states you can go out, and if you want to be a general practitioner, you can go out and practice right after 4 years of dental school. In medical school, that does not happen. After 4 years of medical school, you have to do a residency. So the shortest residency you can do is, internal medicine or something like that, and that's 3 years. And then most people don't stop there. They'll go on and do a subspecialty, or if you want to do surgery, that's, another 6 years, and then whatever your subspecialty is. And so it definitely is a longer route if you want to do one of those other subspecialties. In dentistry, it is a long route if you want to specialize as well. So for example, I went to 4 years of dental school and now I'm doing a 6-year residency. That's 10 years in total. You could go to a 4-year medical school and do 3 years of internal medicine, and that would be a 7-year total. So I'm still doing more years in dentistry than I could have in medicine, but that's because of the specialty I chose. If you just wanted to be a general practitioner, or you wanted to do a shorter residency, like pediatrics, most programs are 2 years in dentistry, then you could certainly be done with dental school in 4 years and add on 2-year pediatric residency or 1-year general residency and still be done much faster than you would be in medical school. So that's another difference, is the time factor. The last thing that I will do to compare both dental school and medical school is just pertaining to the actual school part. So this isn't after school, this is school part. In my humble opinion, and this is my opinion only, the 4 years that you spend in dental school are a lot harder because you basically are kind of combining school and residency, technically, all in one, because most dental schools you have to do 2 years of didactics and then 2 years of clinic where you are working yourself on patients. And so in medical school, a lot of times it's 4 years of medical school, which is a mix of didactics and of course rotations and things like that, but you're not doing too much yourself. You are mostly doing a lot of learning by being, around patients and attendings and residents. And then after which, the residency part becomes a lot more difficult because now you are the one who's doing and you have to spend tons and tons of time doing that. And so for the duration of school only, and so I'm talking just about school, I think dental school is a lot more intense because really it's like combining school and residency all in one, because again, once you graduate, you can go on and be a practitioner. So obviously you have to be competent in all of these different procedures. But in medical school, you can't graduate and go be a physician in your own private practice. You graduate and you're a physician, but you're a resident. So you are still under the supervision of a program in a hospital, and that's when you do a lot of your hands-on learning is in residency. So the residency aspect of medicine is really difficult, but the dental school aspect of dentistry is really difficult. And so when you're looking at just those 4 years of school, I think dental school is a lot more time intensive, it's a lot more stressful, and there's a lot more pressure compared to medical school. In medical school, it's a little bit more relaxed. You're focusing about learning and trying to absorb as much of the information as possible. Of course, you're focusing on your licensing exams and all of that stuff, and you're focusing on getting into residency where you do tons and tons and tons of learning. And so the residency aspect of medical school is definitely a lot more difficult, but the school aspect, I think I would have to say that dental school is a lot more difficult. But then again, if your final end goal is to just be a general practitioner, you can do a 1-year general practice residency, or you could just go out and work. And so even though those 4 years are tough in dental school, you can definitely, you know, be done with them and then move on and become a working individual. And so that's another difference between the two. Obviously, I love both. I really, really do. I think that this was just meant to happen. I was always on the track of going to medical school, and I ended up in dental school, and then I ended up going back to medical school. So joke was kind of on me in that aspect. I really love the idea of dental school being a lot shorter than medical school, and then I ended up doing a longer program. So at the end of the day, what's meant to happen will happen, and it just worked out like that for me, and I'm really glad that it did, because I am so happy where I am today. Whatever it is that you decide to do, there's tons and tons of options out there, so make sure that you do your due diligence and research and shadowing and all of that before you make that final decision. I hope this video was helpful, you guys. If you have any questions, I know that I went through a lot of information, but I wanted to give you the most amount. It's really hard for me to answer personal questions about this topic, like when people say, what do you think I should do? Because, you know, that's really a decision that you have to make yourself. I wouldn't really listen to a whole ton of people's opinions. I would definitely take them into consideration, but at the end of the day, you're the one who's committing to this, so you have to make your own decision. But I wanted to give you just a general outlook, so let me know if you have general questions about both experiences, and I'll be more than happy to answer. All right, you guys, so that's it for today. Thank you so much for watching. Don't forget to like, comment, and subscribe to my channel. You can also see daily posts about residency and all sorts of other stuff like lifestyle, fashion on my Instagram. IG handle is 15 Blades. My blog is www.15blades.com. I constantly update it with tons of material on residency and school and things like that, so don't miss out. Make sure you subscribe, and I will see you next time. Thank you so much for watching.